I find it hard to believe that an entire year has passed since I stood before you seeking your vote. Time flies when you're passionate and you truly believe in what you do. I knew it would be a challenge coming into the presidency at one of the toughest times we, as nurses and midwives, have faced in years. It has been an uphill battle for all of us during the last few months, but it has been one that I have been more than happy to fight and will continue to fight on your behalf. Last year I told you all I was proud to be a nurse, and this last year has only reinforced that pride. Through meeting so many students, nurses and midwives, and witnessing how determined you are in standing up for what you truly believe in. I have found even a greater respect and appreciation for our professions, and I applaud you and say that I feel privileged and proud to be your president and president of this organisation. Now, I know some of you are wondering why I'm doing my address today and not tomorrow following the minister as is normal. Well, my answer to that is, I'm doing it today because I believe I should address you, not a minister who has shown little or no regard for our professions. I feel that you and the members of this organisation deserve my full attention and appreciation. You, the activists, are the backbone of this organisation, and it is because of your ongoing commitment that our professions and this organisation are so highly regarded internationally. I have been proud to represent you around the world, proud to hear praise for Irish nurses and midwives and their abilities abroad. However, over the last few months, our colleagues overseas have been watching us closely. They admire the stand that we have taken in relation to the successful graduate initiative boycott and our overwhelming rejection of Croke Park 2, and I will speak about that in a moment. Our colleagues overseas see the dangers that we are faced with and recognise them as threats to the professions of nursing and midwifery. They see that if they are successful here, these threats could have a knock-on impact internationally. I was particularly struck by one colleague who commented that we are like guardians, standing firm in our belief of the importance of what we do. Colleagues, we are no longer just advocates for our patients alone. We are advocates for our professions, and if we do not stand firm and fight for them, then no one else will. I've had an interesting, exciting, inspiring, and very thought-provoking year. It began with a wonderful trip to Sligo, where I was given a reception by the then Mayor, Councillor Rosaleen O'Grady, who is herself a nurse. Nurses do go on to great things. As this was my first official engagement, it holds a very dear place in my heart. And I have to say, I was overwhelmed by the warmth I felt in Sligo, but also, indeed, the warmth I have received by all nurses and midwives across the country. I have undertaken many visits, but I guarantee you I have a lot more to do. July 2012 saw the launch of Pink Power, a breast check service for our members of the Income Protection Scheme in conjunction with Cornmarket Irish Life and Mater Private. This has been a very successful initiative. The uptake has exceeded expectations, and it was always great to be involved in something positive for nurses and midwives, and God knows there hasn't been very much of that this year. It has been good to see something being given rather than taken, and in a sense, it is very positive to see someone caring for the carers. In August, I had the pleasure of accepting an invitation to the New South Wales Nursing and Midwifery Association, for which I travelled all the way to Sydney. I addressed their delegates at their 67th annual conference to update them on the impact of austerity on Irish nursing. The theme of the conference was taking the lead, organising for safe patient care, and the three-day event centred on the association's campaign to provide safe staffing levels and safe care for patients. Now, this is something very close to my heart and something I hope that this organisation will achieve in the long term. In some ways, we've commenced this long-term objective when we launched our staffing survey earlier in the year, which incorporated all international research on staffing ratios and the value of the registered nurse. These studies, without exception, confirm that the presence of a registered nurse and midwife leads to improved patient outcomes, shorter length of stay, reduced cross-infection, and reduced hospital readmission rates. In short, these surveys highlighted the importance and positive impact our presence has for all patients in all wards. In our survey findings, Dr. Keith Hurst, an independent and renowned expert in staffing and its impact on patient care, clearly indicated that Irish staffing levels were below that of the UK. And this is despite the fact that UK staffing levels have been shown to compromise patient care. The starkest example of this is Mid Staffordshire. The Francis inquiry into the Mid Staffordshire Trust concluded that patients were routinely neglected by a trust that was preoccupied with cost-cutting, targets and processes which lost sight of its fundamental responsibility to provide safe care. The evidence gathered by the inquiry shows clearly that for many patients, the most basic elements of patient care were neglected. Does that sound familiar? Colleagues, I fear, and I know each and every one of you and your colleagues in the workplace fear, that Mid Staffordshire is happening in Ireland today and has perhaps already happened. The main focus of Irish healthcare has not been on patient safety. It has been on budget constraints and cost savings. We know that when the emphasis is placed on savings, rather than at the front line, we see staff shortages, equipment shortages, and shortcuts being taken. These kind of cuts have a detrimental effect on patient health and the progress and chances of survival, and also, I would say, on the nursing and midwifery staff. As was mentioned by Professor Kinsella this morning, that investing in health, we are investing in our future. The situation in Irish healthcare is now critical and unacceptable. Yet government ministers and health service management continue to respond to ill-formed outside commentators who push for further reductions in staff and a downward adjustment of existing skill mix. This effectively means fewer qualified, regulated professionals on ward rosters. I call on you now, as registered nurses and midwives, to stand up and be honest and truthful to our professions and make employers and government act. We must not keep making do. Why should we? When we see and know that care is being compromised, we must stand up and be true to our values and principles. Most importantly, we must show we are committed, compassionate, and caring. We know that poor staffing is one of the key factors to poor patient care, and therefore we should say no more when we haven't enough staff, and we should say no more when we know our patients are at risk. Colleagues, do not stand idly by and watch your profession and career being damaged because of someone else's targets or poor practices. When you say no more, the INMO will stand beside you. I know and I understand that you are all under pressure in every hospital and care area in the country. In acute hospitals, in elderly care, in the community, maternity wards. It is now normal to have staffing shortages on every shift. I've read your motions at conference. I've listened over the last 2 days, and particularly the last motion, and I have listened when I visited your workplaces. I have seen it recently in Drogheda, Limerick, Wexford, Mullingar, Tala, Cork. It is in every hospital. Colleagues, we have to challenge, champion and be committed to our professions and the provision of safe care to patients. Now, I said last year that we were resilient, we are dedicated, we are advocates, we are professionals, and we do care. And let no one take that from us. You deserve to go to work every day feeling confident that your workplace is safe. Safe for the patients you care for, but also safe for you. You should not have to turn on the radio or television and listen to criticism which is often unjust, untrue, and unfair. You must maintain your standards and ensure that the only criticisms coming from our hospitals are those directed at staffing shortages and the cuts that we experience. It is imperative that we maintain our standards even when it says we've had enough, no. Your employer has an obligation to you. Quality and fairness, a health system for you, focuses on human resources and particularly securing, protecting, developing, and effectively utilising the most vital asset in the health service, that is the staff. At the moment, I don't think anyone feels that that is the ethos of the health service. You and your employer have an obligation to ensure patient safety. And it is becoming increasingly difficult for you to safeguard patients when you have no control over the inadequate staffing levels, the overcrowding. But working together, we will do what is right. I must now turn to the recent launch by this organisation of our new measurement of hospital-wide overcrowding, which we've called Ward Watch. This initiative, which is in addition to our long-standing trolley count of overcrowded emergency departments, is an initiative which was instigated at your request following the adoption of a motion at our annual conference last year. The early weeks of this new measurement have demonstrated that 5 hospitals, namely Tala, James Connolly, Limerick, Wexford and Mullingar, regularly place additional beds on inpatient wards, thus compromising the care of all patients without even declaring that they are in full capacity. It is patently clear from the early weeks of our survey that overcrowding inpatient wards is not a solution to overcrowding emergency departments. In fact, it has made no material difference to the level of overcrowding which occurs on a regular basis in the emergency departments in these same hospitals, and we have been saying that for years. We continue with the discussions with the Special Delivery Unit based in the Department of Health with regard to both the emergency department overcrowding and more recently the hospital-wide overcrowding arising from our new Ward Watch initiative. In these discussions, we will continue to demand that the only solution, particularly in the hospitals affected on a daily basis, is additional bed capacity, as no amount of system reconfiguration will deal with the demand for inpatient care in these locations. We all know that all of our acute hospitals currently have bed occupancy rates exceeding 95%, and some indeed exceeding 100%. When desired improvements in patient length of stay, length of admission, and same-day admission rates are considered, it is clear that patient acuity and dependency is much greater now than ever before. This reality of increased productivity in the health system is clearly being missed by those demanding more cuts and cost reductions in our hospitals. We cannot solve our overcrowding problem without additional beds, without nursing and midwifery staff, and without additional community supports. To think otherwise is simply to ignore the reality and to compromise the care of patients. The INMO and nurses and midwives will never be silent in demanding safe care for all patients, wherever they are located in our health service. Last December, without any consultation, let alone agreement, the Department of Health and the HSE announced that it was commencing a graduate recruitment campaign, looking for 1,000 new graduates, but paying them only 80% of the proper nurse salary. I am proud, and each and every one of you should be proud, that this organisation led a most effective boycott against this patently unfair and unjust initiative, which resulted in approximately 80 people applying for these yellow pack nursing posts. The successful boycott followed a tremendous rally, which was held in, of all places, Croke Park, on the first Saturday of the year, and a number of other protests across the country, including the headquarters of the HSE in Dr. Stephen's Hospital. Now, I must applaud, and I must ask you to applaud, all of our new graduate members and our third and fourth year undergraduates for their 100% participation in this campaign. And with regard to the graduates, their absolute refusal to submit to this coercion and thus preventing the undermining Their absolute refusal to submit to this coercion thus prevented the undermining of the pay and value of every nurse and midwife in this country. And I do ask every nurse and midwife in this country to support them. In the words of one of the 2012 graduates from our Facebook page, there are plenty of us out there in limbo, fighting for agency shifts. It gets disheartening, but one thing I can say, no matter how bad it has gotten, and no matter how much I miss being a midwife, the graduate initiative does not get more appealing. I will not sign up. As we gather here today, this initiative has not gone away. I stand here before you, confidently reasserting this organisation's policy that we are against this yellow pack scheme. We are against the underpaying of our new graduates, and we will utilise every resource we have at our disposal to protect their interests, secure proper paid employment for them, and give them a future in this country where their energy, enthusiasm and professionalism are needed so badly. Delegates and friends, we have just completed a robust debate with regard to where we go now from the rejection of the proposals to extend the Croke Park Agreement. This organisation, and I am proud to say, led the campaign to secure the no vote and have these flawed and unfair, unjust proposals rejected right across the public service. The INMO delegation left the talks, which produced this deeply inconsistent and discriminating set of proposals, because we could not countenance being a party in any way to a set of measures which would cut the pay of our members and worsen their hard-won terms and conditions of employment. The equality audit we commissioned by Niall Crowley clearly identified these proposals as having the potential to have a disproportionate and negative impact on women employed in the public service. The audit concluded that the proposals discriminated on the gender ground because they will disproportionately disadvantage women in the public sector and will deepen gender inequality. The audit also concluded the proposals also discriminated on the family status grounds because they would disproportionately disadvantage men and women with caring responsibilities in the public sector. Now, I am proud that the INMO walked out of talks, and I know some of you mentioned it earlier. I am proud our negotiators left. And I am proud that the INMO was forthright and vocal in campaigning for the no vote. I am proud to be part of an organisation that overwhelmingly, in the balloting process, rejected the proposals by over 95%. Nurses and midwives and all public servants have already, as we know, taken 2 previous pay cuts, and we will always continue to argue, paid more than our fair share towards this country's economic recovery. We're not ashamed, embarrassed, or apologetic about saying we have no more to give and the government needs to look elsewhere. They need to look to the still affluent sectors of Irish society to secure additional funds to assist in closing our budget deficit. I know, colleagues, that INO members are living from month to month, many of them not able to pay their bills, many of them increasingly in mortgage arrears, and all of them simply trying to provide for themselves, their families, and their loved ones. We did not party. We didn't cause the country to go bankrupt. However, we're certainly paying the price. And I say to you now, we should not have to pay a higher price than others. And this is not because we just don't want to. It's because we cannot afford to. When we hear of members who cannot afford to put petrol in their cars to travel to work, we have to understand that these cuts will truly hurt. The overwhelming rejection of these proposals, while very welcome, has not to date convinced the government that it must look for alternative funds. The most equitable of these being a progressive taxation system. That is why the Executive Council thought it was necessary to bring forward the emergency motion, unanimously adopted by you in the last hour, which moves the organisation in conjunction with all other public service unions to a possible next stage of campaign. I do not want to be a president of the INMO as part of a public-wide sector industrial action campaign, who participates in dispute action and in defence of our pay and conditions. But if the government forces through by legislation, pay cuts and other negative measures, I will be the president of the INMO that will actively participate in a campaign of opposition, resistance and, if necessary, industrial action. None of you want this. We don't want it. But we cannot stay silent or passive if the government moves to unilaterally vote and cut our pay. The choice is government's. We are willing to engage. We have always been willing to engage. We have always made savings. We have always put forward suggestions of alternative measures which can produce savings without any further reduction in our income, our pay rates, our premium pay, or indeed an increase in our working hours. We now have a mandate for the next step, if required, following the adoption of this motion this morning. Delegates, the INMO will be positive and constructive in any engagement with employers, but we will be equally forthright in conjunction with our public service unions in any campaign necessary to defend your pay and our members' pay from further cuts. This is what a professional trade union does, and this is what we will do without hesitation. Notwithstanding all of these difficult and troubled times, I'm pleased to report to you that the organisation has continued to grow and develop its services to members. I had the pleasure of opening our Cork office just before Christmas. And this fantastic facility is available for training and meetings of our members in the south of the country. Many training days are scheduled for the coming months, and it's hoped to build on this. I'd also like to take an opportunity to welcome our new Nursing and Midwifery Board and congratulate our 6 members, some of whom are here with us today, who were successful in getting elected. And we look forward to a new beginnings and working with the Nursing and Midwifery Board of Ireland in the future. Our Safe Practice campaign has had a very successful year, and we have commenced a legal studies programme which is currently being rolled out. Now, this programme will enable our members to build on the skills achieved in the Safe Practice training. Combined, we hope these programmes will empower nurses and midwives in their decision-making. And I would ask you, if you haven't attended, and also to encourage your colleagues to attend and avail of these free professional development programmes. I would like to thank, and I suppose it doesn't get said very often, and I know we thanked our negotiators, but I would also like to thank all of the other staff employed in both our Dublin and regional offices and our IROs from their offices, who work very hard, and particularly this year, as it was an exceptionally busy year. They show huge commitment to this organisation and to each and every member, and I would like to thank them on your behalf. I must also take time to thank my fellow officers, Geraldine and James, and all of the Executive Council. This year has involved a lot of additional time and effort. They have made themselves available at short notice on many occasions. And I am fully aware that over the coming weeks and months, some difficult decisions will have to be made. We will be required to meet and remain in contact in order to fully represent you. And I would like to thank you for your confidence in us. In conclusion, the last 12 months have seen nurses and midwives attacked on all fronts, from our graduates to our premium pay, from our working hours to our staffing levels. But through it all, nurses and midwives have stood strong, stood together and stood defiantly in the face of the storm that has been unleashed upon us. When the HSE and the Minister embarked on an assault on our professions, little did they realise the depth of feeling, the steely determination and the dogged defence that nurses and midwives through the INMO would display. Those of you that are familiar with conference know that for the past number of years I have at some point mentioned my mother. She herself is a proud nurse and a midwife, and at 91 years of age, I can say she is appalled at the manner in which we are currently being treated. When I visit Mum, the first words are, "Any settlement yet?" And when I say no, her reaction is, "Keep fighting. We've always had to fight, and it's not like we're not used to hard work." I suppose I wonder where I got it. This fight is not over. Now I feel humbled, proud, and ever more determined to continue this fight. I am strengthened in the knowledge that I represent a group of professionals who will stand together and support each other. The INMO is a strong organisation. It is our organisation, and we collectively are a force for good. Our day is coming, and I say we are ready. Thank you.